Gynecological cancers such as cervical cancers and endometrial cancers are very common in India. Now, what I mean by cervical cancer is cancer of the mouth of the womb, and endometrial cancer is actually the cancer of the womb. The cervical cancer is the one which is very common and also is generally detected at a later stage in India. And that can create a lot of problems. So if it is detected in an early stage, we can cure it very easily. Detected in a later stage, it becomes very difficult to cure. I want to present to you a very effective way of treatment of gynecological cancers with what we call as ETHOS adaptive radiotherapy. Now, radiotherapy plays an important part in treatment of gynecological cancers. In cervical cancers, we generally use it as a radical treatment, which means we do only radiotherapy in combination with chemotherapy. Surgery is not needed. And in uterine cancers or endometrial cancers, we first do surgery and then give radiation in many of these cases. In both cases, the aim is to cure and give minimum toxicity. So the ETHOS adaptive radiotherapy is the latest way of treatment of gynecological cancers, which we have launched at Sir H. and Reliance Foundation Hospital in Mumbai. It is a revolutionizing treatment which not only increases the accuracy and precision of the way we treat the cancer, but also significantly reduces the side effects of this treatment. What happens here is when a patient comes to us for treatment, the first step is we ask them to go through the process of radiotherapy planning. The beauty of ETHOS is that it is an artificial intelligence based treatment. So when a patient comes for radiotherapy planning, we do a CT scan for them, and then that CT scan is used to generate an AI based radiotherapy plan. So the artificial intelligence generates multiple plans which will focus on giving maximum dose to the tumor, minimum dose to the surrounding structures, and then the doctors will choose the right plan for that particular patient. And once we have chosen that plan, then the actual treatment process will start. Because this is AI based, it is far more precise and more nuanced. When the patient comes for treatment, we make sure that they are comfortable. There are, very good team is there to assist them through this process. They lie down on the radiotherapy machine. It's a very comfortable environment. We have nice music playing on, whichever music that the patient likes. There's a beautiful surrounding with a nice ceiling with scenic view. The idea is to make sure that the patient feels comfortable. And that is important in the process of this cancer treatment, because just the diagnosis of cancer can make the patients very anxious, and that can have a significant negative impact on patients' quality of life. Our aim at Sir H. and Reliance Foundation is to not only treat these cancer patients, but also make sure that it is done with dignity and utmost care. When the treatment process starts, we first do a CT scan for the patient, and we have a very good CT scanner attached to the ETHOS radiotherapy equipment. We look at that CT scan, and again the artificial intelligence takes over, where it detects the tumor, it detects the surrounding normal structures, and depending on the change in the patient's internal anatomy, and when I say internal anatomy, that means surrounding structures such as urinary bladder, rectum and intestines, they're moving, they're continuously changing their shape and size. The ETHOS adaptive radiotherapy will then generate a completely new radiotherapy plan for that patient for that very minute. So the plan is so sort of adapted or made for that patient that it can't get more accurate than that. And then the treatment is delivered. Now, while we are delivering the treatment also at the time of this planning, we can make use of other images, such as if the patient has had a PET scan, an MRI scan or a CT scan. ETHOS adaptive radiotherapy combines all of them and helps us to again focus the radiation to the right place. The treatment machine is also very fast. It's almost 4 times faster than any other equipment, which makes sure that the treatment is delivered precisely and quickly, so that the patient does not feel any discomfort. They don't have to lie down on the couch for a long time. So they come in, they get the treatment, and they are able to leave very fast. So ETHOS adaptive radiotherapy has made the treatment of gynecological cancers very easy, very precise and with least amount of toxicity. And the way we have built our system, the way we have built our team, is that the whole of this process is done with dignity and comfort for these women who may feel a little uncomfortable because of the gynecological cancers. So we are here to support them. Please get in touch with us if you want to know more about ETHOS Adaptive Radiotherapy or gynecological cancers or any other cancer queries that you may have.